The CDC is warning of a pandemic of unvaccinated. Director Rochelle Walensky says outbreaks are happening in parts of the country where there are low vaccination rates.
Officials say the Delta variant is also rising in all 50 states, and Florida is one of 4 states seeing the worst of the current outbreak. Chad Nielsen, the director of infection prevention at UF Health in Jacksonville, joins us now. We appreciate your being with us this morning.
Yeah, thank you for having me.
How are the local hospitals? Why are they seeing such high numbers of COVID cases, do you think?
Well, it's really the perfect storm of what we're seeing out there. There's still a relatively low number of vaccinated individuals here in Duval County. Only 49% of Duval County is vaccinated versus about 59% of the state average. And so with the Delta variant burning through the population of unvaccinated right now, unfortunately, they're showing up in our hospitals.
What age groups, Chad, are you seeing with a low vaccination rate?
Yeah, it's really across the board, with the exception of the age group about 60 and over who have been very diligent about getting vaccinated. So what we're really looking at is those under the age of 60 are really leading the charge in terms of not being vaccinated. The majority of our hospital cases right now, although not kids or teenagers, is still shifting towards a younger demographic, somewhere between 40 and 60.
And we know that vaccines are not mandated, so people they can make their own decision as to whether they want a vaccination. But what is your best argument for convincing people to get vaccinated?
Yeah, so we've been talking about data and about the trials and all of this. We're well past that. If anybody has any concerns about getting vaccinated because they feel like there's not enough data or the trials were rushed, we're well past that. We have enough data. We know that these vaccines are safe, they're effective. What we're seeing in the hospital is over 90% of our cases are unvaccinated individuals. Those who are vaccinated in our hospital have significant comorbidities. So we know that the vaccines are effective in reducing severe infection as well as hospitalizations. That's a big part of why we need everyone to get vaccinated. The other part is that kids are going back to school in the fall, and largely those kids under 12 years old still don't have access to get that vaccine yet due to ongoing trials. And so even if you're not worried about yourself, please worry about the kids out there who can't get vaccinated as they start returning to school here in the next few weeks.
And you know, Chad, I'm so glad you brought children into this conversation. I have a friend who has a 7-year-old who attends childcare up north who just contracted COVID-19 and is in the hospital this morning. We have a headline of a 2-month-old contracting COVID-19. What are you hearing from parents when it comes to children receiving the vaccine 12 and younger?
Yeah, I think a lot of parents are certainly waiting for the FDA's emergency use approval, which we're now finding out could be as early as midwinter. I do think there's an appetite amongst parents to vaccinate their young kids. I have a 4-year-old myself. I fully plan on getting her vaccinated as soon as I can once the FDA gives that approval. So I think a lot of parents will respond well. I know that the largest groups right now who are getting vaccinated is that 12-year to about 18-year-old. They are flocking to get that vaccine. And so I think it's a good sign that once we can get it approved for the younger individuals, hopefully by midwinter, we'll start seeing those numbers rise and hopefully keep kids out of hospitals.
Yeah, Chad, my 12-year-old was vaccinated the day after it was approved, and she did quite well with the reaction, much better than I did. It'll be.
Yeah, we're hopeful that that the reactions continue to stay very low. What we do know data-wise is adverse events after this vaccine across age groups is exceedingly low, much less than what other vaccines have shown.
It's good to be a kid.
Yeah, Chad, thank you so much for joining us this morning. We appreciate it.
Yeah, you're welcome. Thank you.